Hello everyone, hope you are all doing well. Now we are going to discuss about pelvis. Pelvis is made up of 4 bones. We have the 2 innominate bones or the hip bones, and we have the sacrum and the coccyx. Hip bone further consists of ilium, ischium and pubis. Hip bone has 2 joints, namely sacroiliac joints on either side, and anteriorly the 2 hip bones will fuse together in the front, known as pubic symphysis. So this picture will help you in understanding what I have said till now. So basically we have the pelvis, which is formed by the sacrum, the coxal bone or the hip bone, and the coccyx. Hip bone further consists of ilium, ischium and pubis. So this region is the ilium, this is the ischium and this part is the pubis. And here you will have the sacroiliac joint. Okay, so this region where the sacrum and the ilium bone meets is the sacroiliac joint, and where the 2 hip bones meet in the front or the anterior part is known as the pubic symphysis. Now pelvis is divided into true pelvis and false pelvis by a line that is passing through these regions. So this region is known as the pelvic brim or the linea terminalis. It starts from the sacral promontory, then it passes through the margin of the ala, it comes through the arcuate line, this is the arcuate line, then the pecten pubis, pubic crest and pubic symphysis, then pubic tubercle. So basically the area that is present above this pelvic brim region or the linea terminalis is the false pelvis, and it has no obstetric significance, whereas the region of the pelvis that is present below is called the true pelvis, which has significant obstetric significance. Now coming to true pelvis, what are the boundaries of true pelvis first? Boundaries of true pelvis: posteriorly we have the sacrum, then laterally we have the sacrosciatic notches and the ischium, and anteriorly you have the pubic symphysis, obturator foramen and the ischiopubic ramus. True pelvis has been divided into 3 parts. We can learn true pelvis in 3 parts. We can learn true pelvis in 3 parts. We can learn true pelvis in 3 parts, namely pelvic inlet, pelvic outlet. We can learn true pelvis in 3 parts, namely pelvic inlet, pelvic cavity, then we have the pelvic outlet. There are 4 dimensions here. The dimension of the superior inlet can be said as superior trait. In the pelvic cavity we have 2 dimensions, namely the plane of greatest dimensions and the plane of least dimension. Here the plane of pelvic outlet is known as inferior trait. So this is the picture to help you understand what is the pelvic inlet, outlet and the pelvic cavity. So basically, as you see from the superior view of the pelvis, we have the pelvic inlet. Okay. So this is the pelvic outlet. The region between the pelvic inlet and the outlet is known as the pelvic cavity or the mid pelvis. So this is the inferior view where you are able to see the pelvic outlet. So this is another diagrammatic representation to understand the dimensions. So we have the pelvic inlet, the outlet, and in between we have the cavity where there are two dimensions, namely the plane of the greatest dimensions and the plane of least dimensions. Okay. So this is another view where you will be having the inlet over here. This is the inlet of the true pelvis. This is the outlet, and in between you will have the great dimensions and the least dimensions. Now coming to the pelvic inlet, we have the boundaries of pelvic inlet, namely anteriorly you have the pubic ramus and pubic symphysis. Laterally you have the pectineal and arcuate lines, and posteriorly you have the sacral promontory and sacroiliac. We have to learn the dimensions of the pelvic inlet, which is very important in obstetrics. There are basically three diameters you have to learn. Number one is anteroposterior diameter. Number two is transverse diameter. Number three is oblique diameter. Now, what is anteroposterior diameter? Anteroposterior diameter is the diameter you measure from the sacral promontory to the pubic symphysis. We have three conjugates in the anteroposterior diameter. Number one is true conjugate. Number two is obstetric conjugate. And number three is diagonal conjugate. The anteroposterior diameter of true pelvis is nothing but the distance that is measured from the sacral promontory to the pubic symphysis. And in the anteroposterior diameter, we have to learn three conjugates. You can remember them basically with the mnemonic TOD, TOD. So the first one is a true conjugate. Next one is the obstetric conjugate, and next one is the diagonal conjugate. True conjugate is otherwise known as anatomical conjugate. So, where do you measure true conjugate from? So, true conjugate is basically measured from the sacral promontory to the pubic symphysis superior part. And obstetric conjugate is measured from the sacral promontory to the most prominent part on the pubic symphysis, and diagonal conjugate is measured from the sacral promontory to the lower border of pubic symphysis. So it is basically SP to PS, that is sacral promontory to the pubic symphysis. So the superior part, the most prominent part, and the inferior part. Now tell me, which will be the most easiest one to measure clinically? Yes, it is the diagonal conjugate. Okay, because as we do a pelvic pervaginal examination, we'll be able to measure this diagonal conjugate, which will be from the inferior border of the pubic symphysis to the sacral promontory. So this is how we measure. Okay, so this is how we measure. So we do a pervaginal examination and then we'll mark the border, okay, as you hit the sacral promontory region with the tip of your middle or index finger, you have to mark this point with the other hand. Then you have to take out the hand with the gloved hands, and you have to measure it using a scale, and then you will get the measurement of the diagonal conjugate. From this measurement of diagonal conjugate, we will be able to arrive the measurements of the obstetric and the true conjugate also. So basically, what are the measurements of this true conjugate and obstetric conjugate and diagonal conjugate? It is easy to remember. So basically, diagonal conjugate is 12 centimeter, obstetric conjugate is 10 centimeter, and true conjugate is 11 centimeter, right? So as you measure the diagonal conjugate, if you subtract 2 centimeter from your diagonal conjugate, you will be able to arrive the obstetric conjugate, and if you subtract 1 centimeter from the diagonal conjugate, you will be able to arrive the measurement of true conjugate. Then the next diameter, what you have to learn in the pelvis is the transverse diameter of the pelvic inlet. Now, transverse diameter of the pelvic inlet is measured on the most prominent part of the iliopectineal eminence on either side. Okay. So, this is the transverse diameter of the pelvic inlet, what I am speaking. Okay, it is measured on the most prominent part of the iliopectineal eminence marked on both the sides, and you have to measure the distance before this. So, the transverse diameter of the pelvic inlet measures around 13 centimeter, and it is basically 4 centimeter from the sacral promontory and 7 centimeter from the pubic symphysis. We will see the oblique diameters. You have two oblique diameters. One is the right oblique diameter and the left oblique diameter. Remember, the right oblique diameter starts from the right sacroiliac joint, and it will be up to the left iliopubic eminence. The same way, the left oblique diameter starts from the left sacroiliac joint up to the right iliopubic eminence. And the measurement of the oblique diameter is 12.5 centimeter on both the sides. Okay. So, this is the oblique diameter. Okay. You have to know from which side, which oblique diameter you are going to measure. If it is the right oblique diameter, it will be the right sacroiliac joint to the left iliopubic eminence. Left oblique diameter, it will be starting from the left sacroiliac joint to the right iliopubic eminence. Also, you have another diameter, that is the sacrocotyloid diameter. In the pelvic inlet. So, this starts basically from the sacral promontory to the same side of the iliopubic eminence. Yes, and this measures around 9 to 9.5 centimeter on each side. Okay. The most important diameter of the pelvic inlet is the obstetrical conjugate. Okay. So, this will be the least diameter through which the fetal head has to pass through during normal delivery. Next one, what we are going to see is the pelvic cavity. Pelvic cavity is basically a space that is located in between the pelvic inlet and the pelvic outlet, right? Now, this is a truncated cylinder shape, and the boundaries are pubic symphysis anteriorly and now we will go to the pelvic cavity. Pelvic cavity is basically the space that is located between the pelvic inlet and the pelvic outlet. It is a truncated cylinder shaped structure The boundaries include anteriorly you have the pubic symphysis and posteriorly you have the sacral promontory. As we have already seen, we have two plane of dimensions here. One is the plane of greatest pelvic dimensions and the next one is the plane of least pelvic dimensions. Now, plane of greatest pelvic dimensions, if you see in this picture, you will be able to understand that it lies at the level of S2 and S3 vertebra, and plane of least pelvic dimensions lies at the level of S4 and S5 vertebra. Plane of greatest pelvic dimensions does not have any obstetrical significance, but the plane of least pelvic dimensions has some obstetric significance because the anteroposterior diameter is 11.5 centimeters, and here you will have a interischial diameter or the bispinous diameter. Plane of least pelvic dimensions have obstetric significance. The anteroposterior diameter is around 11.5 centimeter and you have the interischial diameter here which is around 10 centimeters. Mid pelvis is nothing but the space of the cavity that is located between the plane of greatest pelvic dimensions and the least pelvic dimensions. If this interischial diameter is less than 8 centimeters, then this pelvis will be known as contracted pelvis, where there will be difficulty in the normal delivery. Next, we will come to the pelvic outlet. Pelvic outlet is a diamond-shaped area, as you see from below. So, this diamond-shaped area like this. You will have the anterior border at the pubic symphysis, posterior border at the sacral promontory, it is PS and SP, and you will have the ischial tuberosities on either side. If you draw a line through this ischial tuberosities, you will get a transverse line and this diamond shaped area will be dividing into two triangular areas. Basically, here the anteroposterior diameter is around 11 centimeters and the transverse diameters, here we have the bituberous diameter which is around 11.5 centimeters, that is present between the two ischial tuberosities, and this bituberous diameter can be measured with the help of your knuckles. If you are able to pass the 4 knuckles in that bituberous diameter space, then the pelvis is found to be adequate. Also, you have another transverse diameter here which is the bispinous diameter between the ischial spines, and that is around 10 centimeter. Again, if this diameter is below 8 centimeters, then the pelvis is said to be contracted. So, this is the bispinous diameter that is seen between the two ischial spines which is around 11.5 centimeters, and this is the bituberous diameter between the ischial tuberosities which you measure clinically or otherwise in the clinical pelvimetry, and this should allow 4 knuckles to pass through the space. Also, in the outlet you have anterior sagittal diameter and a posterior sagittal diameter. Anterior sagittal diameter extends from the pubic symphysis to this transverse line junction between the tuberosities, and posterior sagittal diameter extends from the sacral promontory to the junction of the transverse line. So, the measurements are 6 to 7 centimeter of the anterior sagittal diameter, and the posterior sagittal diameter measures around 8 to 10.5 centimeters. The anterior sagittal diameter measures around 6 to 7 centimeters and posterior sagittal diameter measures around 8 to 10.5 centimeters. Now, as we have finished all the measurements, we will just put a table and revise all the measurements. So, first we will write the measurements for the inlet, the cavity and the outlet. Here we will measure the anteroposterior transverse diameters and the oblique diameters. So, It's simple, students, like you will put 11, 12, 13, then 12, 12, 12, then 11, 12, 13 here. Okay, this is another 11 here. So basically it is 11, 12, 13 downwards, then 11, 12, 13 in this order. It is completely 12, 12, 12 in this row, and it is 13 centimeters and 11 centimeters. There is no oblique diameter in the pelvic outlet. Okay, this is how you remember. Now also, I want you to know how clinically we are going to measure what is the importance of these inlet, cavity and outlet, and how we are going to assess it clinically. Number 1, pelvic inlet. We have to do a pervaginal examination, and estimation of prominence of sacral promontory should be there. And already we have seen the clinically measurable transverse anteroposterior diameter in the pelvic inlet is the diagonal conjugate. From that we will be obtaining the obstetric conjugate, which is the very important conjugate in obstetrics. So that's how we obtain the obstetric conjugate after we determine the diagonal conjugate. Okay. Then while measuring the pelvic cavity, we have to look for the estimation of the prominence of ischial spines. Then we have to assess the curvature of the sacrum. Then we have to go for the interspinous diameter measurement. The interspinous diameter measurement is 10 cm. If it is less than 8 cm, then it is known as contracted pelvis. As well as for pelvic outlet, we will be measuring if there is any prominence of coccyx. Then estimation of the subpelvic angle should be done. This is very important because the subpelvic angle in the female pelvis is wider and it is around 90 to 100 degrees. Estimation of subpelvic angle is very important because during delivery there will be movement of the joints. Okay. Then estimation of intertuberous diameter with the help of knuckles, as I said, and this intertuberous diameter should be more than or equal to 10 cm normally. Now coming to another point, that is we have to know about the axis of the pelvis. Remember, we have two axes of the pelvis. One is the anatomic axis, another one is the obstetric axis. So what is this anatomic axis and obstetric axis? See, anatomic axis is very simple. We know the inlet, we know the cavity, we know the outlet. We are going to take a center point of all these things and we are going to join them together. Okay, if you take a pelvis and join them together, basically this anatomical axis will be a C-shaped structure. Okay, and during pregnancy there will be some changes in the pelvis as well as the path through which the fetus will pass through this pelvis will also take an importance. So that is basically a J-shaped. So J-shaped in that sense, first it will pass downwards and backwards up to the ischial spines, right? Then from here it will take a curved shape like this. Okay. So to come to the outlet. Okay. So this is basically downwards and backwards, and this is again downwards and forwards, downwards, backwards, downwards and forwards. So this obstetric axis is J-shaped. Also you have to know about this waist space of Morris. Waist space of Morris means normally as the fetal head passes through the outlet, the space between the fetal head and the pubic symphysis. Okay, so this region, it should be less than 1 centimeter. Okay, so this fetal head is around 9.4 centimeters diameter, but the space that will be wasted during this passage of the fetal head through the outlet will be 1 centimeter. It should be less than 1 centimeter. Now, what is the significance of learning the pelvis? Clinical significance. Now, fetal head, as it passes through the inlet, it passes in the transverse diameter of the inlet. Then, in the cavity, the most important diameter is the interischial diameter, at the level of ischial spines, because there only malrotation or non-rotation or arrest of descent happens. Third one, in the outlet, the fetal head passes to the anteroposterior diameter. Number 4, already we have seen about the obstetric axis. So, obstetric axis is basically a J-shaped structure, as we have seen. So, this axis is very important while delivering the baby via instrumental deliveries using forceps or vacuum. So, that is the path ideally you should give, pull. Then, the pubic symphysis or the sacroiliac joints, ligaments, everything will be going some kind of expansion. The pelvis expands during pregnancy, right? So, in that time, there can be pain at the specific site can happen. Yes. With this, we are completing the topic of pelvis. Until we meet in the next video, keep learning. Take care. Bye.